Hi guys, welcome back. In this video, we shall be talking about knee pains, especially knee pains, because this is very common whenever you are getting older or anything, you are going to have knee pain. And if you just see in your surroundings, your family members, some of them is definitely going to give a complaint of about knee pain. So anytime you are having any joint pain, okay. Now, what is a joint? Joint means anytime two bones are coming and contacting, that's a joint, right? And if you're having pain in a joint, there can be only mainly two reasons. Out of these two reasons, one reason is any problem with the bones or any problem with the joint, right? So we're talking about the knee joint over here, right? So one of the very common cause of knee pain is osteoporosis, okay, and very commonly seen in females. And if the age of the female is around 50, 51 years or more, that is post menopausal women, that means they have stopped their menstrual cycle. And females, those patients are definitely going to have a high chance of having osteoporosis, okay. And one thing we have to understand in osteoporosis, what happens in osteoporosis is actually the bone quality of the bone is perfectly fine, but the quantity, the amount, the quantity of the bone is reduced. That's why the bone becomes softer, fragile, more chance of having fracture. But the quality, the quality, right, quality of the bone is perfectly fine, and the quantity of the bone is reduced. Let's say there are 100 bone cells here. Here will be around 60 or 70, but the quality of the cells are perfectly fine, right? That's a very important key factor in osteoporosis, right? That there are many causes of osteoporosis, but the most common is your postmenopausal women, right? Once you reach around 51, 52 years in females, very high chance. Second cause can be senile, that means you're getting older, high chance of having osteoporosis. Third, it can be something hormonal cause, or the fourth, it can be due to uh, prolonged staying in bed. See, our human body is very clever. Anything which is not in use, it will make sure that part is not used anymore. Okay, so if you're in bed for a very long time, let's say you had a surgery of your hip or something, that you're not moving in your bed, so that affected part will go in atrophy. It will become smaller in size. The muscle will become weaker. The bones will become weaker. That is the reason it's very important that you do early mobilization. That means early movement of the area with a lot and lot of physiotherapy. Physiotherapy is to a that extent that you're shouting and tears are flowing down your eyes. Okay, it's very important that you have a physiotherapy. Active and passive movements are very important, right? So what's happened in osteoporosis? Very common symptom will be low back pain. Okay, and if you see for the data and all that, very commonly the most common fracture in osteoporosis is your spine fracture. Okay, and second will be a hip fracture, right? And slowly the patient will lean forward. Okay, the patient is going to lean forward and will go for deformity. That is known as kyphosis. Okay, and to know about osteoporosis, the lab values, blood lab values are generally normal, but if you do a DEXA scan, you are able to find out the osteoporosis is there or not. Okay, so this one thing is your bone. Any problem with the bone will have your knee pain. Okay, and the second thing is your muscle. Okay, this is very important if you go for the muscle. Now, if you are not working out, or if you're not doing any kind of strength movement, okay, you're not going to the gym, or you're not walking, you're running, you're just sitting in the bed or a couch potato, right, and not doing any kind of physical activity, this muscles goes for, they become smaller. In this photo, obviously it's very nice quads. Okay, so this quadriceps muscle is actually maintaining the alignment of the patella or the kneecap. Okay, so anytime this muscle becomes weak, so the surrounding muscles, they start to fight with each other, so there is muscle imbalances. So when this muscle imbalances, there is push and pull movement in the kneecap, and the alignment of the kneecap goes haywire, so you are having knee pain, right? So the overall idea is to make sure that you are having strong muscles and strong bones. How to maintain strong bones? Go to the gym. If you're going to the gym and you have to do strength movement, that is your lifting up of weights. Okay, and you have to make sure that you're eating good amount of calcium, you're having adequate exposure vitamin D. It's very important that you go and get exposed to sunlight at least 30 minutes a day, right? And a good amount of milk products, right? You eat your chicken, you eat your eggs, you eat your milk, cheese. High amount of calcium is there, right? Along with this, you have to make sure that you're doing strength training, very very important. Okay, and you have to do your DEXA scan if you suspect that you're having pain all over your body. You know, you're having female, and the age, as I told you, around 51 52 years, and sometimes you need to even start with vitamin D supplementation, right? This is very 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 important. Okay, and physical exercise is very important. And whenever we're talking about gym, I think I just want to emphasize here, it's not just doing your weightlifting. Yes, weightlifting is very good. It will make sure your joints are strong, your ligaments, your muscle is strong. It's in a, you're burning fat, but only weight training is not focusing much into your cardiovascular health. Okay, the most important muscle in the body actually is your heart, right? How do you train your heart? What is cardiovascular exercise? So whenever you're running, or whenever you're doing cycling, whenever you're swimming, whenever you're jogging, whenever you're sprinting, your heart is beating very fast. Beg your pardon. Your heart is beating very fast. When the heart is beating fast, it's getting exercise. So the exercise of your heart is also very 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 important, right? So do not avoid cardiovascular exercise, or cycling, swimming, running, jogging, zumba, kickboxing, anything. It's very very important that you also train your heart, not just your muscle, right? So again, just to summarize, any joint pain, any bone pain, or any joint pain, mainly there can be two reasons: either bone or either muscle. Bone can be weak, osteoporosis. Either do DEXA scan and eat good amount of calcium and adequate exposure to sunlight. Done. Muscle, keep the muscle strong. Do physiotherapy, do exercise. If you are having a trauma, go and meet your orthopedic surgeon as fast as possible, because more late you do, more damage you're doing to the joints. Okay, you will be having more chance of having arthritis in the younger age, because you're damaging the capsule, you're damaging the smoothness of the bone, right? And physiotherapy is very 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 important, right? And anytime you're playing football or anything, you have to make sure that you're actually warming up the joints. That means you do basic movement of the like active stretching and dynamic stretching is very very important, right? In order to warm up those joints and muscle, increase the blood flow, because studies have shown that if you do it, the amount of incidence of incidence of injuries has been reduced to a very 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 great extent, right? So this was a short video about knee pain, and massages and all these things is going to give you symptomatic relief, but not the actual treatment, right? So that's all, and thank you, and beg your pardon for my voice. I'm having common cold, so my voice is not good, right? And I find it myself funny. So yeah, that's all. Thank you. See you in the next video.